cancer because unlike the breast, you don't see your cervix. And by the time you have symptoms, unfortunately, it's too late. So pap smear is one of the ways that we can actually do this. And then the question is always, how often should I come for my pap smears? Before, abantu used to come twice a year. What we've done now, just to ease izinto, is that we've introduced into by HPV screening or human papilloma virus screening, because cervical cancer is sexually transmitted. So it's one of the very few cancers that are purely sexually transmitted. So if you actually don't have a human papilloma virus, your risk of developing abnormal cells in 5 years is less than 1%. So if you have a pap smear, you have your HPV testing, and they come back and say normal, you don't need a pap smear within 5 years of having those tests done. Then you come back and have another pap smear with your HPV. Enye into esinceda ngayo, the HPV testing, is that instead of just taking your cells, comes back normal, but you actually have the dangerous type of HPV, which is 16 and 18. Zikhona ezinye that are a lot, but those are the two ones that actually within 7 years can cause cancer. We can actually flag and say, no, 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 we actually need to treat you now instead of waiting for the cells to change. So that's the advantage we have currently. So, one pap smear with HPV, and you don't have HPV, 5 years. If you have high-risk HPV, we'll treat you immediately. If you have other high-risk HPV, then it's yearly. Then you have to come and back and see us yearly, and we'll usually tell you that. Okay? Breast examinations as well. So we do that as part of our screening, and then we look for hereditary conditions. So that's mainly linked to breast cancer and ovarian cancer, because those cancers are, especially ovarian cancer, there are people who have genetic predisposition to it. So we then try and see bangobani and then offer the screening to them as well. What kind of gynecological services do we offer? So in terms of diagnosis and treatment of endometriosis, I'll go into a bit of detail into all of these. Treatment, diagnosis of infertility, chronic pelvic pain, fibroids, I mentioned a bit of polycystic ovarian syndrome, women urinary incontinence, and I find this to be very common, especially in black women, but we are people bonyamezela. So umuntu will happily sit licking urine as long as there's pads and not come and seek help. It is not normal to lick urine, so you can actually seek help. Especially in the older women, when they're in menopause, they tend to accept there are treatments that we can offer. We can actually tell you what is the problem and give you treatment for this, including vaginal infections and discharges, okay? Importantly, not every discharge is an infection. Every month, every woman has bakupkoni discharge pumayo, it's usually clear. Ya reka, it's like umfinya. That's normal. That means you're ovulating, okay? The abnormal ones I'll come into a bit later on. And we also offer obstetric services, so that's your pregnant mummies or women. We offer antenatal booking, so we're doing your screening as well as when you do the booking and your care. I do a basic fetal anomaly scan, so basically checking if the baby is well, so all the systems have formed well, and then delivery as well, and then follow-up of those patients, okay? So this includes medical conditions, pregnancy or epilepsy, high blood pressure, diabetes, including your multiple pregnancies and twins and triplets. Right. Any questions? So I'm at as well. So we're at 57A Prince Alfred, and we work during the week. If you want any more information, you can come speak to me. Then I thought, let me go into a bit of sexual health and just let's talk about what is sexual health. It's actually described as an ability to embrace and enjoy your sexuality throughout your life. People believe that your life begins at 40. That's not true. You're actually supposed to enjoy your sexuality even after menopause as a woman, because men start when they are 9 until 90. And no one says anything to that, but for women, there's always these restrictions that we put. So what is sexuality? It's basically what you identify in relation to gender or genders that you are typically attracted to. And then for me specifically, what is reproductive health, okay? So it has to be a complete state of ingqondo. So umzimba, physical, your mental and your social well-being in relation to your reproductive system yakho, okay? So what does that mean? It means for you to maintain your sexual and reproductive health, you need to have access when the information, especially to a contraception, your fertility, okay? And if you're pregnant, then you have to be offered services where your pregnancy can be looked after and delivered safely, all right? Okay. So we'll start off with the hot topic here, contraception. Contraception is basically prevention of a pregnancy, all right? There's many methods we use. We use mainly as gynecologists or even medical doctors, we usually use the hormonal methods, but there's it doesn't mean it won't work for you, okay? But there's contraception for each and every woman, all right? And it's important, Londoleo, especially because we already spoke about a risk. So if you've got high risk of breast cancer or certain cancers, you can't use the pill. There's other things that we can offer you. And then in terms of when you're going to hormonal contraception, what options are there? Commonly, we know the pill, right? The big kids in the block are usually yes men because of the added benefit of the skin. So some people are started on the pill for their skin, so it's great for your skin. So all oral contraceptive is great for the skin. The other added benefit of oral contraception is that it lowers your risk of colon cancer if you've used it for 5 years and more by 40%. It lowers your risk of ovarian cancer and ovarian cysts by 50%. Okay? But of course, it does increase your risk of breast cancer. But it's not, so like I said, it's that if you're gonna get breast cancer at 50, then is this a closer risk, and it's not for everyone, so it doesn't mean not everyone can't use it anymore, okay? What are the other alternatives? You can actually use a patch. A patch is the same formulation as the pill. The benefit of the patch is that when you take a pill, it has to go in your stomach, pass via the liver, kidneys, and get out of the body. The patch is on your skin, so it bypasses all of that, gets into the blood, works, and get out, okay? So in women, we're worried about risk factors. So if you're quite obese, you smoke, and you're worried about your risk, and you can't use anything else, then the patch is actually ideal as well. Or you forget to take tablets, then you can use the patch because you stick it on your skin once every 7 days, change it, put 3 patches, and then the 4th week, have your period, and then start again, okay? The injectables, the favorites. I always say whoever marketed Idebo Petogen to black women did a wonder. You'd be like, Mama, try the loop. Funny Petogen. So we have 2 injectables in South Africa. We have the Noesterate and we have the Petogen, or what's known as Idepo Provera. In Noesterate, you use it for 2 months, Idepo for 3 months. They work, so basically in Ndoba Zenzayo, they suppress the ovaries. Most commonly, they cause you not to have your period. It's not that the blood is building up in your kidneys, it's not in your brain, okay? It's because in Ndoba Zenzayo, they thin the lining of the womb, okay? So there's no more blood made anymore. So when you're having your period, we're shedding the old lining, so it has to go so that a new one forms. So injections are not to be a lining that forms anymore. So you don't have a lining to shed, and that's why you don't bleed, okay? And the other thing about the injectable, the problem is that it can also, in some women, it can cause them to bleed abnormally. So you're bleeding throughout the months or for the 3 months. So that's a side effect. So if that happens to you, we need to change it. And the other thing that usually happens is that for you to return to fertility or fall pregnant and ovulate, it takes a long time. So if you're looking at Petogen, you can go up to 9 months, sometimes in some people up to 2 years, because it builds and sits in your muscle. And if you are into Benjingam, it actually tends to stay longer. It doesn't clear much quicker, okay? What are the other options? E-implants. The new baby Matchsticks implant was introduced about 6 years ago. Hot kid on the block, everybody had it. And then one person in Cape Town, someone got stabbed at Kuchwa. No one wanted it. The story in Cape Town is that so they no longer use it because the kids smoke it and yes, but apparently it's true. Promise you. So Implanon, the hormone that's in the Implanon is very similar to the injectables. Ne? So it works the same way. So in about 3 out of 10 women, they actually don't see their period on the Implanon. So it means the side effects is yafana, meaning If you are bled on on steroid, you're gonna bleed on the Implanon because it's the same hormone. So don't think you're gonna change to Implanon if you have bleeding problems. Don't use it. So it means ayo yako. You need to move on to something else. All right. The good thing about it, you can actually pop it underneath your skin, up and and it's usually, and you can have it in for 3 years without having to worry. Okay. Just a little bit to touch something about injectables in the young girls, okay? Because most of the time, umama, they drag their girls to the surgeries. Abayaz no baba zotini. It's all awkward for all of us. Please speak to your daughters, okay? Educate them. Tell them what you are worried about, pregnancy, what are the problems, infections. Unfortunately, you can't Wi-Fi parenting to other people. We can help, but it's your sole responsibility. Just because you get injectable doesn't mean she can't get HIV, all right? But what are the issues with using injectables on the young one? So by young, I mean at least less than 16 years. What we found that is that especially when they have umzimba omncinci, so the BMIs uxabajongile omncinci kakhulu, and you start the injectables early, when amathambo abe loose and they can break easily, and they're prone to osteoporosis. So in the girls who's thin and young, we usually don't then offer the injectables to them, okay? Not everybody knows this, or definitely not the clinic. So it might not be the best place to take your children, but just be aware of these things. And no, the pill, okay, so lastly. Of course, my favorites are what we call them intrauterine devices. We have 4 in South Africa, but the main groups is Zimbini. We have the copper T. Basically, it has copper wired around the loop. How it works is that the copper is toxic to sperm. And the fact that the loop is in the uterus, it prevents the egg and the sperm from meeting. Even if they do meet, because it's clearly prior, the pregnancy can't implant. The benefit about that is that it's for 5 years, you don't have any hormone influence, so your body still works as per normal, so meaning your side effects are much less, okay? If you're a woman who has very painful periods, heavy periods, the copper T is not for you, because it makes it worse, okay? But we have their sister, or sisters, there's 3 of them. The one people know is Mirena, which is the loop with the hormone in it. It sebenza for 5 years, right? Meaning every single day, it copy hormone into your lining of the womb. Yenzibe thin, ungafumani period, and then also causes the ovaries is suppressed. It has got its twins, Iskala. Iskala, you use it for 3 years, so it's the same thing, but and you now use it for 3 years. And then Kailina, it's just smaller. So for the young woman who's 18, we can actually put in a Kailina for her because it's much smaller, okay? But they're all the similar in way 1. What are the normal hormonal things that you can use for contraception or preventing pregnancy? Condoms, very careful. The benefit of condoms, actually the message is dual contraception. So even if you're on the pill, use the condom, because the pill won't prevent HIV infection, it won't prevent HPV infection or the sexually transmitted infections. So we're supposed to be using both. And the thing about, so most people tend to use only condoms. They're terrible for contraception because of the use. So if you know how to use condoms properly, you have a less than 5% chance of falling pregnant. But if you use it, it's got a 15% failure rate. Because you're suspicious, the new Kupi condom doesn't work that way, okay? There's other things, not commonly used, a cervical cap, but it sits on the mouth of the womb and prevents sperm from coming in, okay? So you fit it 3 hours before you have sex, and then you take it out, okay? And then the lactation amenorrhea layer is for people who are breastfeeding, okay? For it to work, funeka exclusively breastfeed, meaning uncancisa qha awunikeza formula, and it works for 6 months, because then after 6 months into yenzekayo, women tend to introduce feeds, then akasa breastfeed regularly, then the hormones will start to kick in, okay? And you mustn't be getting a period. So if you're breastfeeding and getting a period, it means you're ovulating, which means you can get pregnant. As long as you're breastfeeding and not having a period, you're safe. But I have to warn you, You first ovulate before you have a period, so you can actually fall pregnant without knowing, because you will ovulate, iqanda will be fertilized by semen, you fall pregnant without knowing, so you still have to be careful, okay? It's not the safest of methods, but it's a method that's available. Then the worst one ever, withdrawal method. No one's game is that strong. And guys always fail. And the problem with this is that there is something that's called precum. So before a man ejaculates, there's already, depending on when recently he had sex, there's already semen lying there with sperm. So even before he comes, there's already sperm that has gone up. So it's the worst thing you can do to yourself, okay? Remember, contraception, it has to be safe. It has to be accessible. You have to be able to get it every month if you need it. It has to be affordable, okay? And its side effects, for instance, ipilisi, they make your breast terribly tender. So you have to decide, is that something that's acceptable for you? Okay? Injections, they will increase your appetite. You eat like you're not okay in the head. You're not even aware, all you're doing is eating because your appetite has gone through the roof. They tend to decrease your libido as well. Okay, so women tend to complain about a lot of loss of libido, especially the injections. So you have to be aware of those things and understand what can you accept for yourself, not for your neighbor, but for you. Okay? And then we have issues around in contraception. We know that our clinics are very overcrowded. You go there, shout about and that's not necessary. We have a lot of myths about contraception. I've already touched on a few, you know. And no, a pill won't introduce and it's not the contraception as moshum. And like I said, you need to have relationship with your children. Explain to them, okay? Besides the thing about with the bone and the injectables, they're pretty much safe unless we can, of course, risk. And we deal with that on one-on-one basis. And the other thing is, the main thing for me, I find, is acceptability to society. We're a very judgmental society. And we decide on things, and once we've decided, then you can't tell us anything else about that. And I feel like we need to change our minds because we see what is happening. Our children are having sex at a much earlier age. They're getting pregnant early. So if that's happening, that we also need to change our mindset and accept as izinto zikhona and can be used and they're quite safe. All right? All right, I just put up a picture just to show. So the loops, those are the two ones. So the one, ngatine plastic, that's the Mirena type. And then the copper UCD, you can see the copper all over the string, and then zihlala ngola hlobo inside the uterus, and they're basically there. What you'll see is that there's a small string that hangs outside the cervix. It's just for us, classy jonga, and because after 5 years, it will not give your husband penile cancer or infection. That's basically plastic, okay? And what happens with the pressure, they actually coil the nucleus slightly around the cervix so they don't cause any problems. Some women actually experience a lot of discharge in loop. It's quite common in the first 6 months because you're reacting to this thing because it's a foreign body and usually it settles with time. These are the pills, and then that thing over there is a female condom. They're still around this corner. The problem with the female condom is very tedious. Try putting in one yourself, even as a gynecologist. Frustrating, because that part is open and then this ring at the end is closed, right? So what you're supposed to do is actually insert this part in so that it shall against so that the penis will get into the other end and then squirt semen or up so that it doesn't go in. The problem with this, you need in the vagina for 6 hours before you have sex so that it unwinds and sits properly. And what happens inevitably, the man will push the coil in and then it just doesn't work well as the male condom, okay? Okay, briefly, on STIs, basically they affect both male and female, and the infections of the female genital tract, they're sexually transmitted, okay? We have, besides HIV, the ones that are common, gonorrhea, chlamydia, and syphilis, okay? What usually happens mama with everyday life, we call them bacteria, or in the vagina. That's their home. What they do is that they balance the pH yakho, right? So that it discharges at a certain pH. Infection, so they're almost protective. They stay there, that's their home. But once you get any of those three, siyafika and disrupt a happy home, and then as is then they also get a chance and cause havoc. All right? What are the risk factors to STIs? Contraceptive is protective against STIs, so if you're not using any contraception, multiple partners, and obviously unprotected sex. How do you know you've got an STI? How do you present? Most commonly, you discharge. Discharge is usually offensive. You've got three colors that are always yellow. Okay? Yellow is chlamydia. Gray is your family in the vagina. So once they've gone up, they cause a gray discharge. And then you have green. Green is for gonorrhea. So once you've got a green, green, then that's more telling of a gonorrhea. You may have pain during intercourse, and most commonly they present with low abdominal pain. Okay, and if you're really sick, and if infections say you can have fevers, all the time. How do we treat this? We treat it, and this is very important, we treat it with the antibiotics, all right? And early is better, because the problem that we see is that as soon as they get an STI, they present with what we call a UTI, okay? So be warned, ladies, your man can never ever get a UTI unless he's got other problems, but men are protected against, which is unlike abandabango mama. The problem is that our urine pipes are shorter. So it means all the bacteria quickly goes up and can cause an infection. Men who have two valves which close, which means it's like almost impossible for them to get a UTI. If they've got UTI symptoms, it's usually an STI, and they go to the doctor because they know that's trouble, and they get treated. You don't know, infection in your gile, it's now resting in the tubes, and it's been 3 months since your partner has got treated. And what it's causing is causing a destruction, or tubes are getting closed, and they actually, I don't want to say destroyed, but zionzakala. And then, so once we start to treat early, then we can actually prevent a spread before infection in Yugi Pezulu. We decide whether you need a treatment, or most commonly we give you outpatient way from an injection. Is 7. Okay, so that's usually sufficient, especially if you go early stages infection, but as stages as Pezulu, then you have to be admitted in hospital. We have to offer you safe contraception, and we have to treat your partner as well. Okay, it's not a witch hunt. It's not to say nguwe or nguye. We have to do these things, all right? And like I said, not every discharge is an infection. What are the consequences of STIs? So women may present with chronic pain because after umzimba upholile after an infection, it usually causes izitho zangaphakathi zidibane or to get stuck together, because usually isibeleko is quite free and can move around. When that is no longer happening, it can predispose to pain. Ne? Infertility. So if you look at infertility that is caused by STIs and cause damage and close female fallopian tube, that accounts for 30 to 40%. So that's already your 4 out of 10 couples that this problem, which is completely preventable, causes, which is the bulk of infertility, all right? And the problem with that is that you have your 2 fallopian tubes, once they close, it's very difficult to get them open. We've actually done research, and we think once it's near impossible to open them. So for you to fall pregnant in tubes it has to be IVF. That's the most successful way to fall pregnant, all right? And if tube completely, but a pregnancy can result in tubing instead of moving in our prakati, ectopic pregnancies, okay? Chronic pelvic pain syndrome, this accounts for about every third patient we see that consults a gynecologist for this problem. Ne? What are the common causes? PI, so the infections, if you've had it, chronic PID. There's a condition called endometriosis. I'll just briefly speak about it. If you've had surgery before, so you've had a Caesar, you've had appendix removed, and these phakathi, which is called adhesions, it can also give you pain. And then in women, we've got quite a lot of blood supply in the pelvis and phakathi and cause pelvic congestion. There are non-gynecological causes for pain. Because remember, it's not only isibeleko, fallopian tubes, and the ovaries. You have isinyi ngapambili. At the back, you have your spine, emqolo, and you have your muscles as well. And all of those things can also give you pain, okay? And then briefly speaking about endometriosis, what is endometriosis? It's basically when the lining yakho yesibeleko ngaphakathi, implanta ngaphakathi kwesibeleko, and also on the outside. It's not supposed to do that. It can implant with fallopian tubes, it can implant with ovaries, emathunjini, sinyi, and cause a lot of pain. So it's a terrible pain disorder. It accounts for about 40% of chronic pelvic pain, and it also causes infertility if you've got this condition. So how do women typically present? They have painful intercourse, okay? And then infertility, and then that's marked is pain, period pains that you get, okay? They get severe period pains. When you're menstruating, it actually causes activation, lesions, the endometriosis that are in the pelvis, and resulting in the period pains. It's a very difficult condition to manage, because when you have pain, the body almost wants to play a trick, or the mind wants to play a trick. Is what they call pain sense or pathways, so that so that you don't focus much on the pelvis as well. So that's what happens with chronic pain, is that you have pain pathways that are caused. So we usually manage it, the best kid on the block in Dobis by Vizan. So Vizan has got a specific progesterone, Dobis by Dynogest, and basically has been proven through research to basically says lesions endometriosis and make it better. It doesn't stop or make it completely go away, it makes it better. Eclaira has also got Vizan, but with estrogen, and you can use it for hormone, for ezilandu contraception. The gold or mainstay of treatment, cameras ngaphakathi, landobiz by keyhole or laparoscopy, apho sizokwazi ususa zonke apho lesions endometriosis zikhoyo sizisuse, and then sikunikeza iVizan to suppress. Yeah, so that's basically the best way. It depends what type of or degree of endometriosis you have. If you've got the severe type, then it's best to be operated ngabantu who deal with endometriosis every day, because then you'll get the best benefit. What are the psychological implications is that you're always in pain, so you always have chronic debilitating pain. Because of that, women tend not to be sufficient at home because they're qaqanjelwa and people think you're acting up. You're unable to bear children because of inflammation, there's infertility, and there's always marital strain, and people is in about they end because of this, and no one understands because no one feels your pain, so it's always like, oh, where's this? But we can diagnose it. So your general gynecologic ovarian syndrome, what is this? Basically, what happens, this is an endocrine disorder, meaning it's a disorder yamadlalo omzimba, where you have, so like what Dr. Zulu has said, we all have, females have male hormones in their body, but they're in low levels, and the reason why we have it is for libido. So we feel recharged. When you have intercourse, you can have ivavavum, okay? So that's why we have testosterone in our bodies. But what happens with it, because those are very high, right? So they're almost similar to the male ones, and as a result, abantu mama present with inchebe. So they have hair up here, around their breast, on the stomach, and they're very hairy. With that, you can find out if that the period zako will go missing. So as mama, your body is made that in such a way when you start with the period zakho, they are supposed to continue oko until they stopped by a thing. So either usebenzisa contraception or umiti. But other than that, you're supposed to always have your period. So if you're not, then it's a alert sign for us, but could you be having PCOS? And then what will typically happen is that you'll skip for 3, 4, 6 months and then have a heavy bleed because the lining is thick and that's why you're having that heavy bleed. And there's possibly nothing we can do about it until your lining has been shed. Then it's cycle you miss your period and then bleed heavier again. And these women also become infertile but from a different cause. When you're not having your periods, you're not releasing an egg, meaning an ovulate, so there's no egg to be fertilized by sperm, and that's where the infertility comes from, which is different from the 1-year STIs or a tubal factor, because that one means fallopian tubes is valekile, so akukho ndawo yodibana. This one means omnye wabantu abafuneka badibene akekho. Okay? All right. So it's associated with obesity because in Duenzekayo, if you're obese, like what Dr. Zulu explained, there's peripheral conversion here, your androgens into estrogen, diabetes mellitus, cholesterol, and high blood pressure. And because our shared lining yako over years, that puts you at risk of endometrial cancer, which is the cancer lining yesibeleko. How do we manage it? Because so we can't do it. It's not only pills. It has to be a lifestyle modification, especially in the women abane issues with the weight gain. If you lose about 5% or your weight yako onayo when you're not getting your period, you can actually make yourself ovulate naturally without needing pills. So we always say encourage women to lose weight. Otherwise, if you're not, because of the risk of endometrial cancer, we always have to shed that lining, and we can do it again. We can give you some medication to do that. Importantly, because our ovulate, you can't fall pregnant. So in women, we force the ovaries to sebenze. Okay? And that's how we treat that infertility. So it's one of the infertility issues that are treatable. PCOS accounts for 20 to 30%, so 2 to 3 out of 10 couples, the infertility. So we've looked at our 10, so we said 4 is about the tubes in 2 to 3 will be that a liquid ganda to be released, meaning your last 3 is your husband or is your partner, okay? Meaning 30% of all infertility is actually male infertility. So it's important that are for or a consultation for infertility, so your mother-in-law can say, you have to bring your husband because he also accounts for 30%, okay? And then there's other things. So I just wanted to mention the two, Egenet, NET-IN35. The nice thing about them is that they've got a hormone called CPA, and it actually lowers your testosterone levels, so that inwele, the acne, and the balding, ingabikho kangako. It doesn't stop as it says but it yens bazingabikho more that's produced. What can you do for the hair? Say pumile, please don't shave. Right? Because if you shave, you're gonna get ingrown hair and then you have bumps on the chin. Laser is the best way to do it, but if you can't afford laser, then sebenzisa iskere very close to the skin and cut the hair, don't shave, okay? All right, this is one of the most common but least spoken about. Typically, mama will come because I cannot libido, but they'll never say, doctor, I libido, Mrs. Ans. Oh, nepeni elapa. Enye elapa. Then oh, by the way, doctor, you libido yam, as she's walking out of the consultation. Okay? So we're very shy to speak about this topic. This is called hypoactive sexual desire disorder. So this is a complex one, not complex, but because for you to, it's all about when you, as a female, when you want to have, so unlike men could be sleeping and have an erection, we're not like that. For us, you have to imagine it, qala, okay? Uyifune, then you have the desire, then you're stimulated, you're aroused, then as with the intercourse, and then at the end, climax. So it's a whole cycle, all right? So when you have this condition, you have abscess or sexual fantasy. You don't even fantasize anymore or dream or thoughts. You have no desire, you have no reception. Even if it's where you're just lying there and thinking, akho kutya." Or the inability to reach orgasm during sexual activity, which is, by the way, you're right. And this usually causes a distress in a relationship. What are the main causes? The main commonest causes is what I've put as a relationship issues. If you have conflict or lack of trust in a relationship, especially if you've had your libido, we were fine, and then all of a sudden it's gone, you have to see what's going on with the relationship. There are other medical causes that can cause it. As I've mentioned before, especially injectables, the two, because they reduce your hormone levels, your testosterone levels drop. And the Genet 35 and the Diane, they do the same thing. When we treat for the hair, we actually can drop the levels too low and decrease your libido. Okay? There are some, so the oral contraceptives, the Genet 35, and then the antidepressants as well can do that, and certain pain medication. What medical conditions? Depression, anxiety, if you have low self-esteem, so you've gained a little bit of weight, not sexy anymore. Breast cancer, diabetes, and urinary incontinence as well can cause us, and thyroid problems. How can we treat it? Unfortunately, I can't just prescribe eflibanserin for you and send you home. We have to see what are the issues. Is it you don't feel sexy anymore? Is your husband cheating? Do you suspect he's cheating? What is the core issue? We always have to treat the core issue. If you find that there's no core issue and you're worried, okay, maybe it's the injectables, then we'll stop the injectables. If it's the pill, we'll stop the pill. If it's your antidepressants, we'll see if you can't change to anything else. If it is your diabetes, we need to control your diabetes, all right? And then, of course, the obvious things. You as a woman, you have to know your body. You have to know what makes you happy, what makes you sad. When someone presses there, what happens? It's your duty to know those things. It's not your husband's duty. And you have to tell him what you want, what you don't want, because that's part of the therapy for this. Counseling is very important, especially if there's issues in the relationship. And then medical treatment, we can actually give you medication that will increase your testosterone levels. Okay. Questions? Sorry, Nana Nandimos.
Good afternoon, everyone.
Afternoon.
Okay, my name is Nale Dingubani. So I have two questions, but regarding the previous slides. Okay. So one was about contraceptive methods.
Yes.
So I'm currently on Implanon.
All right.
And I've been on it for 6 years. So I'm on my
Second
third
one.
Second,
Okay.
No, I'm on my third one.
Sure.
Yes.
Okay.
So my question is, will I be able to conceive after I've thought about family planning? I won't have a problem
Okay.
after I've reached a certain age and I've found a potential other.
That's important. All right. Once you find a suitable sperm donor, the answer is yes. Okay?
Okay.
So what happens with the implant or Implanon? Every day there's hormone released into your blood. As soon as you take out, that goes away. Okay? Especially if you've been having irregular periods on the Implanon, it means you quickly go back into a regular cycle. If you've been amenorrheic, meaning you haven't been getting your period, now it's not more than 6 weeks where you actually go back to a normal cycle. So the answer is yes.
Okay. And then my second question, basically there's a trend on social media regards to herbal medicine. I'm sure we're all aware of yoni herbs, yoni detox, etc., etc. Many women purchase this for yoni detoxing from companies or businesses of people who are not educated medically or doesn't have adequate information about these products that they are selling. So what is your opinion about yoni detoxing, and are there any benefits since people are purchasing these products? Is it safe? Is it dangerous?
Okay. Tandi knows it's my pet peeve in life. Oh, guys. For me, it's always about this concept that people implant in our heads that we're dirty. Okay? There's always this thing that, "Bafaz bamdaka," you're not dirty, okay? Like I explained, in the vagina there's bacteria, that's good bacteria that sits there, okay? doesn't cause any problem. It's there to basically clean you out. Umzimba cleans itself out. So this whole notions of is sepu, this herbs, is born out of umdaka. You have to clean yourself. You don't actually even have to wash the vagina. As long as you pass aphandle, the labia, it's self-sufficient, it can do that. So I personally don't believe in those things because there's no evidence. So Klabetate, people and they've actually researched and they found other benefits in this. There's no evidence to support that iyasebenza. So as abantu bemfundo, we can't support it on those bases because the things that we use in medicine, ziyajongwa and get regulated, and that's why we prescribe them. I'm not saying so sebenzisa yoni herbs zakho. I'm just saying don't use them because you think you're dirty. You're not dirty, okay? You clean. Isibeleko sakho doesn't need to get cleaned. Siskoni, God has made it clean and hygienic on its own. But if you feel it works for you, then use it. But medically, there is no evidence for it. Okay?
Okay,
And sorry, the other thing about this is we actually, because it actually goes back all the way to breastfeeding. We're a society, because of the food we eat, the environment is ngoku, because of carbon emissions. Singabantu aba sensitive. Even our babies are born and umntana has an allergy a week later. The other issue with this is actually they cause allergic reactions and you end up with discharges and you think you have an infection. Meanwhile, you're just allergic to isepu, okay? To these herbs that you're using. So I always say, if we chronic discharge that you chronically have and no one can answer, change basic things. So, yeka life boy, use plain aqueous cream uhlamba ngayo. Watch the lining of your panties. It has to be cotton. So ungasebenzisi nylon or any other lining your panty. And if you're using panty liners, they must not have a scent, okay? And ungazigobi ngevaslap as well, please. There's no need.
Doc, with the follow-up questions, we're gonna, cause of time, we're gonna take 2 to 3 at a time, and
Okay.
then you answer them one shot.
Sure.
So here's another one coming this side.
I don't know if anyone has seen this trend, but then with the loop, the intrauterine device, I've seen like babies being born holding that loop. Is that true? Because
Okay,
it
all right.
doesn't seem possible.
All right, so the answer is, ayikho contraception. Sorry, I forgot to say that. There's no contraception that's 100%, okay? Ungavala and still can fall pregnant, right? Every contraception has a degree of safety or upping azugumithisa khona. So if the loop is one of the highest ones, they've got a 99%. And it xhomekekile on who inserts it because funeka ihlale all the way pha phezulu. If ayihlelanga pha phezulu, it's halfway of ihlile. Iqanda lizawungena kwi-fallopian tube, isperm sizadlula and they will meet and a pregnancy will happen. So kubalulekile xa ufakwe loop, after 6 weeks funeka uyocheck kwi-loop yakho uba ihleli kakuhle na. What we'll usually do is izawujonga izi-strings uba zikhona and then scan sijonge uba ithini position ye-loop yakho because it has to be well fitted for it to work. If I fit it, which is what we find with these women, is that ihleli pha emlomeni wesibeleko, so it's not working anymore. And I've not seen a baby holding a loop, by the way. But you usually see that, uzaxele uba bendine loop, and then they will come pregnant. Then obviously, then you have to discuss it with mama to decide what you want. The current recommendations are if umeti with a loop, we can't remove it because if seyitsala, they can actually cause a miscarriage. We therefore remove them. Okay, so the answer is that there's no contraception that's 100%. The one that is closest to perfection, ilando yotata is by vasectomy, whereby tie tubes is otata because after 3 months and there's no sperm, you're basically safe with that one. But all the female ones is in risk of pregnancy.
Good afternoon, everyone. Gama lami ngu-Asanda Lisa. I've been living with HIV for about 15 years. And treatment, I think, 6 years ngoku treatment. Now, recently, my treatment was changed. I think it was about 3 months ago. And it was alarming to me to find out on media that I could have, it causes birth defects. Unfortunately, for now, I don't have medical aid. Therefore, I access medication, a clinic. and not much information was given to me when medication was changed. So I just want more information as to kule ndawo ye-birth defects, kule medication ndithathayo ngoku.
All right, very good question. Okay, so HIV medication for a very long time, when efavirenz came into play, we also were worried about birth defects. So all the women of reproductive age, bebe gunevarapin. As ixesha lihamba, then we saw it's actually not the efavirenz, it's the age of the woman. And then we said it's safe, everybody can use it. There's a new kid on the block, it's called DTG or dolutegravir, all right? It's a cousin ye efavirenz. The benefit of sebenzisa DTG is that resistance ye HIV to the treatment is very high. So it doesn't, you hardly become resistant to the treatment because you have to lose it for ixesha elide. So that's the benefit we're seeing with the DTG. The other problem with efavirenz is that, especially xa uqala usebenzisa, it causes you to have those vivid dreams, ube ngathi uyaphupha, and you have these bad dreams. And they've actually looked at it and see, but long term, it actually causes ingxaki zengqondo zomama. They have something that's called an encephalitis. So they may actually end up almost like bayagula mentally because of the treatment. Then DTG came into place and they actually found that that was much safer and you eliminated that risk. With every good thing, there's a bad thing that comes with it. So into abayibonayo ngoku, especially the first 11 weeks of pregnancy, there is a 2.6% risk, meaning abantu abathathu in 100 babies will develop birth defects from DTG. So ZT regulations or recommendations, if you're gonna fall pregnant, you're not, don't use it DTG, okay? Rather, also then it's safe because you're not gonna have any more children. Or if you're pregnant, use it after 3 months of pregnancy because it's still stage apumdana bumbeka khona. Okay, so that's actually not a myth, it's true. There are birth defects associated with the DTG. So the current recommendation is not to change mama on the treatment they are in, unless you're worried about resistance or they don't want to have children anymore or say pregnant in above 3 months of pregnancy.
Hello, Doc again.
Hello, my love.
You know, most good relationships, when you want to spice up things in a relationship, a bedding, by the way, and then you try anal sex, and then accidentally, iyongena phanga phambili. Can that cause infection or what?
Okay, it can't give you an STI unless your partner has an STI. But what happens is that number 2 has a lot of E. coli, which is, it sits in your gut, but it's terrible for your bladder. So once it comes into contact, it can actually cause you to have a UTI and not an STI. Okay?
Hello, Doc. Over here. Hi.
Oh.
So my questions, I've got 2 questions. One is regarding IUDs.
All right.
And it's not a personal, but a friend of mine had it, and she found out some time after she had it that there's side effects that can not cause, but maybe aggravate or add on to depression or trigger some, like your depression, side effect here, copper IUD. So I'm not sure if all of them are, but I know specifically in a copper IUD. That's my first question, depression, connection of depression with IUDs and
Okay.
that family. My second question pertains to yeast infection.
Okay.
I didn't hear, well, it's probably personally one of the most common of discharge, like cottage cheese or and what do you use for it? What do you avoid? What can you take? Citron, yes.
Okay. All right. Good questions. Number 1, the copper UCD has no hormones, so it's got virtually. So unfortunately, I can't with certainly say 100% depression has nothing to do with the IUCD, but research says there's no connection between the two, okay? Because any is just preventing iqanda and the sperm from meeting. and a pregnancy from forming. So there is no clinical or research says as connectanga. What you may possibly have is if you're using the Mirena types because it's in a progesterone. So whatever gets secreted in your body for ixesha elide can actually move out of the uterus, and the progesterone has been known or associated with the depression. So maybe ke Mirena, if you've used it for a very long time, it can have that association, but not copper. Number two, indaba yeast infections, very good question. The reason why I didn't put yeast as an STI, because it's not an STI, yeast. So yeast or thrush or candida is one of the family, the good family that sits in the vagina. So everybody's sitting with playground kudlalwa kahle until you get a UTI and then unikwe antibiotics. So all the other school kids leave because now it's so silly, you've taken antibiotics, kusheki yeast. Then idlale yodwa in the playground. And how you see that, kuphuma ke ngokula nqaka, thick white discharge, uyarhawuzelelwa. Most commonly emva kokuba utye antibiotics. If you're diabetic, if you're pregnant or immunosuppressive or whatever is the immune system yakho, will result in yeast. What can you do? We have to usually treat it, get simple, you treat it with the antifungals, and now benzoyl formulations where you can just put one ovule in the vagina and usually sorts it out. If you're pregnant, unfortunately, because you're pregnant for 9 months, it comes, we treat it, and then it comes back again. What I usually tell women is that xa uprescribelwe antibiotics and you know that emva kokuba utye antibiotics you've got a yeast problem, cela ugqirha wakho akuprescribele into ebizwa uba yi-probiotic, okay? So i-probiotic izakwenza uba as abantwana aba in the playground bangahambi after you've taken your antibiotics, bahlale, right? So it's not a primary infection yeast, but it's a result of, okay?
Afternoon, Doc. Ndingunomapha. I want to ask, what is the best treatment when you've got a teenager that has menstrual cramps? You've tried every treatment besides into contraceptive because she's old enough to decide to buy akazifuni zona.
Okay.
So what can you recommend?
All right, good question. So in the period pains or dysmenorrhea, you've got intlobo ezimbini. We have something that's called primary dysmenorrhea. So those are women who have period pains, especially xa bengena bantwana. We examine, we can't find a cause because one of the commonest things, endometriosis, can give you that, okay? We examine, we don't find endometriosis. So those, especially abantwana abancinci, they usually have what we call primary dysmenorrhea. It doesn't have a cause, organic cause. Usually, xa bebelekile, once umntana abe nabantwana, for some reason it just goes away. Ingabikho anymore. Unfortunately, there is nothing a treater better than a contraceptives because contraceptives, you put your ovaries to sleep and you use your hormones zangaphandle, and then that's how they actually get relief from pain. What I usually say, if abafuna ukipilisi, you can actually use a patch instead. Ubafake patch, instead of usebenzise patches in datu for 3 weeks and remove it, I fake patches in 9 izlandelelana for 9 weeks so that angafumani period, and then the last 3 months afumani period sakhe, which are going to be much lighter, much shorter with much less pain. So enze londo, it's called tricycling, so you're preventing ufumani period, wasn't like a period, so you prevent your period. Obviously, you know that will be better as injections, especially for ufumani period, then they'll give them relief. What you can use engage or hormone that helps is analgesia, so indoors a pain. So anganikwa into esibizwa non-steroidals ngexesha lokuqala kwe period pains zakhe. One that is very, very good into ebizwa Zefo. It's XEFO, but you need a prescription for it, or Evoltaren. It actually works very well. Unfortunately, you have to put it in your bum, so she can use that for many period pains. It works really well if akafuni hormonal treatment. Suppository, Evoltaren or into is by Indocid. Yeah?
Hi, Mihlali. When you were talking, you talk about teenagers and their mothers. I want us to address this because it's a concern. They bring their teenagers, 13, 14. Doc, I don't want to be a grandmother. Please inject. Some teenagers are not even aware that they're going to be injected or Ndoni. So I just want you to take us through medical ethics of doing that to a child where the child has not consented.
Okay, very
And
good.
also, some mothers would take that up to abortion. Yeah.
Okay, all right. So if you look at medical ethics, I'll briefly go through the subject. So when you look at ethics, in a 4 components. We speak about something that's called autonomy. So autonomy means, I know what I want, I know what I don't want. Regardless of who says what, if and if it can be done. So this goes for all things, even especially. If someone says you have to go for an operation and you feel like you don't want it, it is your right not to have it because of phone. They might have explained why you need it, but you feel if you don't want to, it's your autonomic right to say, to have that respected. Same thing. So that applies abantwana ke. In terms of contraception, we initially said 12 years, but now we've actually seen that they start early. So akukho minyaka. So she comes at 9 and she wants the contraception, she can be offered, but it can be offered on her behalf. So if akaifuni, the child cannot be given. It is their right to say no, especially when they're above 12 years, because mentally banayo reasoning capacity to say andifuni ngoba. Okay? So if abati abaifuni, unfortunately we can't give it to them. Same thing as the abortions. In South Africa, unfortunately, akukho age where a child can be prevented from having, or a woman can be preventing from having an abortion. So the same way as Funa, we have to give it, it's the same way Funi, we can't do it. Because you can actually be sued and you will lose that. Okay?
Okay, I have a question, Doc. I'm realizing that because we don't have relationships with our medical practitioners, mostly because the route that we use for contraceptives, we all go to clinic, no medical aid. It's a easier route and a quicker route, and because we don't have those conversations, what is myth and what is gossip tends to become gossip. So one of the things that is usually said, is it really true that you can get you'll forgive me with the terminologies on the UTI and the STI, that you can get a UTI or a STI from using public restrooms? That's my first question. And then my second question is that you spoke about STIs that are out there, and one that still seems to be underground, but I'm seeing it come up in conversations amongst other women, or other women who are actually shocked that it exists, is HPV. Okay, clearly I was not meant to mention the HPV. It's HPV, and I would love for you to talk about it, because from what I hear from the people who've actually had it, it sounds very scary. And I actually found out, speaking to Umaka's it's actually what they used to call back in the days, Itushua. So I didn't know what it was. So can you please talk to us about that as well?
Okay, all right. So let's talk about restrooms. You can't get an STI from a restroom. Okay, you can possibly get a UTI, okay, and that's basically hygienic purposes. So we usually say, "Kawosula, don't wipe from the back to front, because you bring whatever is in the back to the front. You must wipe from front to back, okay, and you can actually make it tissue akibe manzi first to clean properly, all right? So, theoretically, if someone has peed on the toilet seat and uhleli phayana, theoretically, I mean, really pushing it, you can. You can't get candida from a public toilet or an STI, please. Okay? If you're not sure and you know about sensitive, carry wet wipes and clean the toilet seats. All right? Number 2, HPV. I've touched on it a bit. The human papilloma virus. It's actually not a tusho is syphilis. So HPV, which is the human papilloma virus, 11 detained, it actually causes cervical cancer. All right? So there's 2 twins, 16 and 18, okay? There's other ones, or 31 and whatever, they can also cause cancer, but 16 and 18 are the ones that we screen for. So if you do your pap smear sins in HPV and you come back 16 or 18 positive, we actually have to treat you, because within 7 to 10 years of having them, you can develop cancer. The thing that essence basing is the pap smears, so I always cringe when virgins have pap smears, I almost want to die. It's unnecessary. Because it's almost always sexually transmitted, if you're not having sex, your risk is gone. You've eliminated your risk. So as a virgin, you don't need pap smears, okay? And for abantwana as well, so HPV mainly attacks umzimba if you're immunosuppressed. So we know that young girls from up to age of 25 can actually clear, including with 16 and 18, umzimba ulwe and overcome that infection. So we don't start pap smears to before 25 because even if you pick it up, sometimes mhlambe la ntombazana could have cleared that infection angabi nayo anymore. If you haven't cleared it by the age of 25, then we have to treat. Okay? So no early pap smears before 25 unless you're HIV positive. That's a different thing because your immune system is kakade. So we'll screen when you when you get diagnosed.
Sorry, a follow-up question on HPV. The story that was doing rounds of that guy from TV.
Oh God. You put you put cancer cells in my womb, you destroyed my life. That video.
So people were asking, and I was like, when do you know when you have an STI? Have you treated the STI? Do you know if the STI is causing now? Because the story is that that girl cannot fall pregnant because she was and I was like, okay, my medicine doesn't answer this, but I want the gynae to explain.
Okay.
Can you get yes, there is STIs, we talked about them, but can you know now, getting an STI today or this year, and know that, okay, I'm infertile, I'm what because of the STI that I got?
All right. So what she's actually referring to, let's get this clear, no one is condoning cheating, right? What we're all against is the fact that that's not fair. And she's a bit exaggerated, the whole thing, oh my God. HPV specifically, unfortunately, I can't tell you that you got your HPV izolo, you had it 10 years ago. The fact that already if you're having a cell change, it tells me at least you've had it for 5 years. At least. Could be more, you've had it for more than 5, some people say 7 to 10 years. The fact that you're starting to have cellular change, it means you at least have had it for 5 years, okay? And I think the problem that people do is that when you diagnose with an STI, you want to witch hunt and see ngubani. It's happened, we need to deal with it now. So HPV, yes, it's a sexually transmitted infection, but when you start to have your cells as abnormal, you've at least had it for 5 years. Okay? And unfortunately, it's not only, so because even sometimes with the condoms, you can actually get it from skin contact. So it's that evil that we have with us. The only thing that has been proven to work against HPV is the vaccines. And currently in South Africa, the government, because of the budget issues, they're only issuing our girls the babies by Severix. It's against 16 and 18, okay? The other biggest problem we have is the warts. Or vulval warts, we call them a cauliflower, okay? That is also HPV, unfortunately, but it's another different type, it's 6 and 11. For instance, in Australia and the first world countries, they have got Gardasil, which protects against 6 and 11 as well. So they've managed to get rid of cervical cancer and vulval warts.
Afternoon, ladies. My name is Patty Sazono. I've got 2 questions, Doc, with regards to the contraceptives. Earlier you mentioned that there are lots of myths with regards to the contraceptives. Now, I want to know what happens when you start the contraceptives early, because we are one of those girls who were dragged to the clinic, but there was something that was saying if you start early you will have a problem with inzala in the future. Is that true? 2, contraceptives and age. Myth nayo, because there's this difference, and when you are older, the response emzimbeni wakho, is it supposed to be different? Because umzekelo ngoku at this age, iyangigulisa mna i-contraceptive than ngela xesha I was still younger.
All right. Good question. Okay, so we'll start with indaba yenzala in contraception. Okay, so contraception, by the virtue by your own contraception, you're trying to prevent a pregnancy. The issue is with the two injectables that I spoke about. It's not that they will cause you to be infertile, it's a return to fertility. So when can you start ovulating again? So I said it can be anything up to 9 months and sometimes abanye abantu 2 years. So no, it doesn't cause you to be infertile. It's just that lixesha elide for your fertility to return. Ne? Number 2. Oh, Gulus, okay. So, you know, different words mean different things to people. So when you say to a gynecologist, Ian Gulisa contraception, I always want to know the specifics. Because umdomgulayo could be in the when bleeder. Those are all different things. So we specifically need to know what is the cause, because the common things are ukopa. So you tend to bleed. Instead of ngabina period now, you're just bleeding throughout. That is a problem, and then if that happens, we need to stop and change. There's been an association with pain syndrome, so women tend to report a lot of back pain, especially for injectables. There is no specific pathway about why isenza njalo, but we see it in women. Once we stop it, and actually they feel better. So we can't say IOD and Zekai, but in terms of research, I see born about why it does that. Okay, weight gain definitely, because it increases your appetite, and the problem is that once you've gained weight, you're more heavier than you were. It can actually put a strain on your back, your muscles, you're more tired, on amandla as well, and of course the libido issues. Those are the ones that it causes.
Oh, good day, Doc, and the people in the house. Thank you very much for the opportunity. My question is, in the past 2 weeks, I've gone for a mammogram and ultrasound. And then when the radiologist was reading the interpretation of my results, he said, I can't remember the medical term that he used, but he said he saw that in my breasts, I might not be able to breastfeed if I can have children now, because there's something that shows by ubusa luzophuma, because I might have used contraceptives for a longer period of time.
I'm not aware of that. I was saying, Dr. Zulu, do you want to? No. Yeah, one of the few things that I am aware as a gynecologist that can disrupt that process is if you've had breast operation and they've played around with the ducts and the lobules. That can, especially kubantu abangomama who previously had big breasts and needed reductions. If they played around, especially in the nipple as well, by moving, by bigger when down, you might have problems. Yes, because you've messed with the anatomy a bit, but I'm not aware of any contraception or in breastfeeding. Sorry, ma'am. Ukang wazang wa operate beleni ngaphambili? No.
Hi, Doc. I wanted to find out if, as doctors, do you guys have the conversation? Because from my personal experience, I've experienced ogqirha that are very judgmental. Like when you go in for a consultation and you ask certain questions, you're told about God, you're told about often contraceptive, you're like, no, you can't mess with what God wants. I don't know if you guys have that conversation amongst yourselves, but when someone comes in for a consultation, asks, when they ask certain questions, rather than being umzali or being umntu wasecaweni, can you be a doctor first? Because I'm ending opinion from your gynecologist, because I'm being looked a certain way. And is it right as a patient when I'm faced with that? If I come in, I ask for a contraceptive, or I ask for maybe an abortion or something, what rights do I have to say, I actually want this, regardless of what the Bible says?
Okay, all right. So, what God wants is different from you and from me. And as a doctor, I have to almost put my God wishes away and deal with you as a patient. Your rights are, if you're a woman, you fall pregnant, you do not want the pregnancy, you can have the pregnancy terminated up to 20 weeks of pregnancy, okay? Above 20 weeks to 24 weeks, we only allow it for certain circumstances, and above that, very few circumstances, and doctors have to decide upon it. So you're right, goes up to 20, when 20 weeks, it's not that you want, we have to look at your circumstances, but up to 12 weeks, you can actually come in and say, and this phonesis and your termination will be done. My spiritual rights are that I can decide, because of my obligation with my God, that I don't want to do terminations. In that case, I'm not allowed to say God doesn't want this. That's not your business. It's my business and my God for my termination, okay? Mine is to say, my love, we don't offer the service here. Please go to doctors Banbani, they offer. So it is, so when you go consult and Ugqirha says, and it is your right that that doctor has to refer you to someone else. So they can't say, Asiyenzi ahamba, that's not enough. They have to refer you to someone else. And if you've done a termination, you've come back, you're bleeding, une complications, the doctor can't say, because your termination, I can't treat you. No. Because now things have changed. Your life is at risk. The doctor has to treat you. Because now it's no longer biblical, your life is at danger, okay? So your right is, as a woman at any age, up to 12 weeks, you have, it's called termination choice. That one. You can terminate for your choice, all right? And if the doctor doesn't agree, he has to refer you to someone who does it, okay? Because now, if you fall pregnant, you take that pregnancy up to 9 months and you dump it and you say, but ndandile kwasimama, and Smama said, abazenzi terminations. I'm also implicated in that. Okay? Because I have to show you where it's done. It's your right, unfortunately. Same goes for contraception as well.
Good day, everyone in the house. I have two questions, Nadok. Zikhona i-common symptoms onothi like kawuzawufumana i-periods uthi no easy, like you don't have to mind. For example, abanye abantu bazaba namabele aqandileyo, abanye bazaba ne-bloated stomach, abanye bazaba namathumba apha kusisi. Zinormally na ezeziphi onothi ayifuna ukuphakama xa ubona ezi or izinqa zibuhlungu, zeziphi ezi onothi hayi awuzinormal ziyenzeka. Omnye umbuzo wami, STDs zikhona ongafunekanga uzitreat eziphelelayo or ufuneka utreat yonke?
Okay, all right. So first question. So different women experience different things. Some people don't have anything and they just say, qali period with the blood, okay? So they experience nothing. Most women will experience amabele, the breast tenderness, the bloating, okay? They may have a bit of cramp, so it's abnormal to have mild dysmenorrhea. The problem with those is actually ulcers, and what that is called, that's something that's called herpes simplex virus, okay? So it's actually an STI that unfortunately you have in your body. We can control it, but asikwazi uyisus. And it flares around ixesha menstruation, because around that time there's also been association, but for some weird reason, immune system yakho iyehla ngela xesha umenstruate ngalo. And you can have these blisters around the vulva. Because when I was born, you may not see them, but xa uzijonga, it looks like they're terribly painful, and they itch ziyababa before ziphume eza blisters. That you can do something about. Because in like is that because we can only treat it xa unayo. So when you feel that burning period ziyeza apha kusisi ngaphansi, you can go to your chemist and buy isaclove or laliqaba apha with fever blisters. It's the same thing, it's like fever blisters as gases. We grab it before the blisters come out. Okay, shall we continue? Okay, and then just to end things I thought, let me just put a small of a gynecological implication with breast cancer, since that's the day. So we know that breast cancer is the most common cancer type yabantu abangomama. And as Dr. Zulu has already alluded to, but we're seeing it actually in the younger women. What is the problem with that? Already, what are your treatment options? One of the treatment options, especially determined by stage, is something that we call chemotherapy or radiotherapy, where basically the way we describe radiation is almost ukuchiswa. It's not true, but it works in a similar light. The problem is that because of cancer, they have to mark a field abazokunika kuyo radiotherapy, right? And most of the time, especially kubantu mama, that field includes the ovary. If you give radiation, you're basically destroying, not destroying, but ubulala maqanda in the ovary, okay? As part of the treatment, and therefore the woman can become infertile. So siyasithini, if a woman who's still wanting to have children get diagnosed with breast cancer and you need chemo radiation, you have to come see your gynecologist first before having your treatment, or your surgeon has to say, go see your gynae, what do you want? Then you come see me, we'll talk about it. One of the things that we can offer is that because you're young, you possibly might have a genetic mutation. So Landioba, you're disposed, which you're susceptible in your genes to have a cancer. And one of the common things is by BRCA1 and BRCA2, because especially with the BRCA1, it's not only ibele, it's also the ovary. So that's how I'm involved, all right? So we'll offer that genetic counseling a bit so you can actually get tested for it. And if you do have the gene mutations, then how do we treat it? So if you want, I think it's in the next screen, so that's fine. So that's importantly, especially for the young women with the gene mutations, that's where we come in. And we've already spoken about the risk factors, is that if you have first degree relative with breast cancer, that's quite early, or your male breast, or your father has breast cancer, then you also at risk for that. Or umamako at age less than 50 had bad ovarian cancer and she died from ovarian cancer. You might actually be having that gene. So we have to screen for that as well, okay? Like we said, it includes the breast examinations in mammograms, and we've already spoken about the difficulty with mammograms at breast density, especially bandabango mama bancinci, and that's where your MRI will come in. Then for ovary, then we screen gegazi to see, and then send the ultrasound to look for cysts, because cancer ovary always starts as a cyst, so we look for cysts for them. What are the psychological impact, Yako, of having breast cancer? You have, because of what I spoke about, including chemotherapy, there's loss of fertility for you. Because you're attending treatment, there's loss of income, increased medical bills. Yeah, there's cosmetic issues. After a mastectomy, and you don't feel like a woman. And most women, because of the treatment, especially in state, your chemotherapy, they don't have hair and vakoko, and you go into early menopause, especially if your ovaries have been radiated or you had chemotherapy. How do we manage? We as a multidisciplinary team, so Dr. Zulu is going to be involved. You'll have your oncologist, because they deal with the radiation and the chemotherapy, and then you'll be referred to us if then there's issues and they want us to speak specifically about fertility. How can we spare your fertility? Because your breast cancer will probably kill you. So, but you do, if you live through your breast cancer and you still want to have your children, what are your options, all right? So we won't say, don't be treated for your breast cancer, radiation. We won't say that, but we'll give you your options, right? Because it's life-saving. You have an option of freezing your eggs. This is also quite popular. It's on, they call it a cryopreservation. All right, yamaqanda akho. Basically what they do, bakunikeza hormones to stimulate your ovaries zakho, and we go and suck out all those yamaqanda aphumeleyo, and then we freeze them and keep them, and you can actually freeze them for very long periods of time. There's actually currently no determination of how long you can freeze your eggs. This is also an option for the woman who is busy with a career, but ixesha liyakushiya. Okay, so you can actually freeze your eggs instead and continue your career and have your children later on. Because with women, at 25, amaqanda 25 years old, because you're born with them. When you're 14, ayaguga. And the problem is that the problems is with age, and we know that it's mainly age dependent, because at 40 your risk of having with Down syndrome is at least 25% to 40%. When you're 45, it's about 50% based on iqanda alone. Okay, so it's an option to freeze your eggs when they're 25, because if they're frozen at 25, they're still 25-year-old eggs, all right? And you can get pregnant at 40 with your 25-year-old eggs. You can get someone to donate your eggs. So carry on with your treatment, and tell sister wako to give them your to be mixed with your husband's sperm, I mean, those are options, but guessing abantu abamnyama thina we tend to, uzaba ngowakwabani laa mntana. Then what we can do in DOSIB is by ovarian transposition. So it means singazikhupha ovaries out of a field. So bazasixelela uba okay, izaba lapha ifield yethu, then we go in and operate sizibhekelise. They'll still be affected, but not as much if we move them out of the way. And of course, the surrogate, so someone else can actually carry the pregnancy for you, and you can also adopt a baby, all right? If family yako is complete or you're not interested in fertility, then we usually say it's fine, go ahead, all right? But it's important, even though that happens still sporadically, kungabekho iqanda eliphumayo ngoku you're on treatment, you can actually fall pregnant, which is the worst thing ever, because that medication you're using and the radiation, they're very toxic to the baby. So that's not a pregnancy that we'll recommend you keep. We'll probably recommend that you terminate it because of the possible toxicity to umntana. So you have to be on reliable family planning if you're on treatment of your breast cancer and you're still reproductive age yako. All right. Unfortunately, we can't use, because it's hormones, we can't use any hormone because they can, depending on whether it's a hormone responsive or receptor positive tumor. If we give hormone, we can actually aggravate the breast cancer. So we don't use any, depending on what type it is, we just decided we don't use it. And then, of course, then the hormone options will have to be non-hormonal. So a loop instead, you can use condoms as well. Or you can actually have a sterilization and be done with it. All right? Okay. Then there is a specific subset of women. So once you get diagnosed with ilantuki cancer, breast cancer, you have your operation done, you have your chemoradiation, then the babon it's actually hormone sensitive. Bagnegezinto by tamoxifen, which is part of the hormonal treatment. The problem with tamoxifen is that it causes a lining, yes, aggravate, and with ixesha you can actually get endometrial cancer from this treatment. In public, unfortunately, ngenxa cost issues, the government can't afford to give you any other treatment, so they still use tamoxifen, but it's rare in the state for them to use tamoxifen unless they have to. Okay, because there's other things that don't cause this problem. But if you are on tamoxifen after your breast cancer treatment, please be aware that it can cause this problem. And if you're mama or semdala or safumanis period and you start to bleed, please yellow. So there's no normal bleeding after a period zakho stop for unyaka as mama mdala. That's all abnormal. We have to check it out. Or usaye exesheni but now ufumanisa uba ixesha li-irregular ndiyableeda for 2 weeks in pin and stop it, we have to attend to that because it could mean you're starting to develop endometrial cancer on tamoxifen. Okay. If we see that you're on tamoxifen because usually they prescribe it for 10 years, we can try and diagnose it. If you find it's cancer, then you need to be treated for endometrial cancer. But if you find there's cells cancer, but as your cancer, we can actually remove a If you don't want that, then we usually surveil every 3 months just to have a look and see. Okay. What can you do for your hot flushes after your breast cancer or your postmenopausal, and you've had breast cancer treatment because it doesn't make you immune to your hot flushes? Like I said, we can't use the hormone replacement therapy anymore because of the hormone risk. So we don't use it at all. But what can we do for you? We can try and modify your lifestyle. So if you lose your weight, it's been shown that it decreases the hot flushes significantly as well. And then, jacket is heavy, you must layer your clothing. Is light that you can always take off and on. And then aircons and fans as well. And then there is treatment that we can give you. It's not as effective as hormone replacement, but it's better than nothing. Okay. And that's it. Thank you.
Okay. I've got a question, Doc. I'm one of those ladies who started pushing the career thing, and now I'm 31. All of a sudden, we are thinking age, you know. And unfortunately, it's not something that you invest in. I'm going to withdraw that investment because you need a partner to do that. And like I say, myth becomes gospel because now 30, age wrong, right, early 20s, uba pregnant. So, like, what are like the age of okay, within your 30s that I'm asking, that you feel like this is a high risk pregnancy?
Okay, so medically we call it advanced maternal age, okay? 35. Okay, from 35. The risk of it downs is always there in a woman, but it's much less. So when you're 25, it's less than 1% because the same, but when you're 35, it starts to go to about 10%. When you're about 40, we said 25 to 40%. When you are 45, sorry, then it's about 50%. Okay? It's the same thing, the miscarriage risk yakho. So a miscarriage risk yakho is linked to the defective egg or wrong pregnancy. That also increases because of your age. Okay? So 35.
Okay. And then just another quick one with the freezing of the eggs. How much is the hotel stay of the eggs?
It depends. It's about 2.5 a year.
Hi again, Doc. I think I also want to ask more about freezing the eggs because I also want to go through the career line. So how successful is this procedure once you are ready to unfreeze them and you want to become pregnant?
All right, okay, good question. So it's better to freeze, it's gonna sound wrong, a human than an egg, right? So into is by embryo. Okay. So science has evolved because galok it means, imagine for that 40% of ilanduke couples who have tubal factor or eat tubes is valekile, it means all those people will not be able to achieve pregnancy. So IVF is actually an answer for them, right? So egg freezing is part of the IVF process. It's the initial process. So when we IVF, baqala ngo stimulate ovaries kamama. So we need about 18 to 15 eggs for that process. So usually injections to stimulate your ovaries. That usually happens in the first about 20 days of your cycle. Inject with the hormones, then was cool ovaries. It's man strong and yes, kulana and manga pilamaqanda koyo. Once we reach a stage where we think, okay, we have enough, then when zindobis back would trigger so that uzobe azoba machola maqanda, then gengok ayo kuchwa. Okay, then you allow with theater, bangene kusisi, basakshine onke la maqanda. Okay, then it pela up for you if you're freezing your eggs, so as of suction out, ufakwe free agcinwe. If you're going a step further for IVF, then bazawuthatha imbewu katata bayidibanisana namaqanda a lab, then babone okay benze embryos, then bazazijonga uba zingaphi ezingathi zizawuba right. From la 20 yakho. So bafumanisa okay, there's about 4 or 5 embryos. Then baxelele okay, besifuna amaqanda 20, but we managed to get 5 embryos or possible babies, so to speak. Then you decide bafuna 1, kufakwe 1 ngaphakathi kwesibelekweni or 2. Ngokomthetho, medically they're not allowed to put more than 2 because it means you could have triplets and that's going to have very high risk pregnancy. So the limit is 2, right? But if unomtu that you're sure about, baniza ukuba for 10 years, you can do the same thing even if anfuni bandwana. Freeze your embryos zenu nobabini, right? And continue with your lives. Because when you look at success IVF after freezing embryos, you're looking at about 60%. Okay? There is no guarantees with IVF, I'm sorry. It's very expensive. The minimum you pay is 70,000 cash. Even Prof Med that covers it, abai coverishi yonke, but there are no guarantees. At best, they will say 70%. But it might be, you might be the 3, you might be the 7. Okay? And this means and for you to have umdana uzawugoduka naye, because some people miscarry. So you look at about 60 to 70%. With the frozen eggs, I would say about 50. Okay, but I'm not an infertility specialist. This is just my general knowledge. Okay, so the best thing to do is if you're sure no baby wakubano fanlahlane, freeze your babies. Okay, otherwise if you were enough for yourself, then you freeze your eggs.
Oh, Doc, quick question. Here I am. Okay, I need to ask according to my own personal experience. At age 20, I got pregnant. I had a son, but I gave birth prematurely. I'm not sure because I was still young. I don't know how many weeks I was, but ndidla ngothi xa ndiyibalisa ndaba nguyesu. I woke up in ICU after 3 days due to the severity of the preeclampsia I had. And kuye kuthiwe, when you're still young, there's high chances of you having a healthy pregnancy. So I want to know what causes that. At age 32 again, I had another pregnancy, and it was quite difficult as well. I had a preeclampsia again, and at some stage when I went to my gynae that I was using in East London, she told me, you know what, let's get rid of this, because chances of you surviving or the baby surviving are slim. One of you is not going to make it. So I went through this whole spiritual thing, debating in my head whether to keep the pregnancy or listen to this doctor. I decided to come back to Queenstown and get a second opinion. I went to Dr. Pinzi, and she told me that no, anything is possible if you believe. But I, as a doctor, I'm going to tell you the honest truth. Whatever that she said is true. But if you have so much faith that you want to go through with the pregnancy, promise me one thing: you're going to see me Mondays, Wednesdays, and Fridays. And I spent most of my time in private hospital. Like from Friday to Monday morning, I would be admitted because there would be no one to look after me. And then they will take my bloods for, I don't know what those things were, platelets and whatnot, until I decided to go randomly on a particular Wednesday, which was my birthday, for a checkup again. And she told me, you know what, it's too late. We can't take it any further. As a result, when we performed the C-section, my daughter was not breathing and not crying and not doing anything. And they tried and tried and tried until she actually came to life. Now, my problem is they don't want to actually bandivale, because I've always had traumatic experiences when it comes to getting pregnant and going through the whole pregnancy thing. So I want to know, what rights do I have as far as this thing of ukuvala is concerned, and what are the chances of me having another healthy pregnancy? Because I want to be like other women and enjoy my pregnancy as well. I hardly ever, because I'm always in and out of the hospital, getting all sorts of threats and what might be and what might not be. When I eventually give birth, I'm told the baby might not make it to whatever age. But fortunately for me, they both survived. They still, I'm sure they will live even beyond 70 years. So, so now I want to know, like, is there a chance of me experiencing a normal, healthy pregnancy ever again?
Okay, all right. Thank you. Good questions. So, 2 issues. Preeclampsia. It's something that we chase as obstetricians. It seems to elude us, all right? There are things that we know for a fact about it. So what preeclampsia is, for people who don't know, is when you develop a blood pressure that is caused by the pregnancy. It's associated, with proteins in emchameni, okay? You have different severity or ubunzulu, ubunzima bayo. Some people get some women don't get it at all. Some people get mild disease, some people get moderate disease, and some people get severe disease. When it's severe, you can have a stroke, you can have, or you can actually go completely blind, you can have fits, you can have amanzi agcwale emiphungeni, umntana ngafa because izamva ziwele zisuke, izintso zingayeka usebenza, isibindi singaqabuka. So that's all catastrophic, because when we train or specialize as a gynecologist, not to say I don't specialize for the low-risk pregnancy, but that's not my focus. My focus is that woman who's got a ruptured liver from eclampsia, the kidney problems. That's why we do what we do. It's for that woman. Because we know that it can happen. By law, we have to say, Sisi, if it happens at 26 weeks, it's very early. Possibility is, because we can't say with certainty in medicine, because we didn't create medicine, God made everything. So we have to give credit to say, Tina, in our experience, is that this thing, next week, it could be next week, it could be in 2 weeks, it could be in 5 or 10 weeks, these things could happen to you. In some cases, azenzeki, and they actually are fine, the blood pressure carries on. But now, if you decide to keep the pregnancy, we have to watch you like a hawk. And instead, you actually stay in hospital from Melaklash diagnosed with preeclampsia until 34 weeks to watch for ezando bentetengazo. Okay. Anything yazo yenzeka, we have to deliver the baby because then your life is at risk. Because if izinso zakho damaged, you may actually go into chronic kidney problems. If it's been discazukile, we'll never be able to rupture to fix it. You might die. If you can actually not be able to breathe, or you have a stroke. That's something that possibly we might not be able to reverse. Okay, so it's the extremes that we study for and to prevent. So that gynecologist was definitely not wrong. We have to give you that information. It is your decision to make with your partner to say, do we want to go on or not? If you want to go on, then can you possibly stay in hospital for most of that pregnancy? All right. Number two, I cannot unfortunately guarantee you that you can't have preeclampsia again, because what we see, we know that the young womb or the young patient who gets pregnant young is at risk because the sasbeloko has never been pregnant before. As Azamva have to attach into the uterus. Because of that, we can have the issue with the preeclampsia because that's an innocent womb. The older women, because of her age now, that uterus is too old, we run into the same problems. Then they are at risk of having preeclampsia as well. But there's everything in between. Form, having what we call toxic sperm. So your husband might actually be the person that you're struggling with. Nina no babina not, I can't say you're not compatible, but the immune system is almost rejecting his seed, so to speak. It sounds crude, but it's more or less that. It's immunological. Umzimba wako doesn't take well to that because umdana is half yours and half his, and that's what could be happening, okay? You might actually be having underlying problems. So abandabane blood pressure kakade, the risk of having preeclampsia is higher because you know blood pressure already. So it can happen. People who have ingxaki blood vessels, things like SLEs and that, they're at high risk, and diabetes, we've got very bad diabetes. So especially in young women, it can actually happen in them. And then there's a saying that says, but if you're pregnant, you have one foot in the grave, because you're actually testing your body for all extremes, if it can handle it, and that's where most things is adverse. So it's been shown that if you meet and you develop preeclampsia, you actually have a risk of getting a chronic hypertension. So it's actually been shown that your risk is there. If you get diabetes in pregnancy, it's actually unearth your risk of getting diabetes later on in life. All right. Most women will have the unscathed free pregnancy, but there's the spectrum, but that's the spectrum like you we have to look after. All right. Then importantly, let's quickly do indaba yokuvala. What are your rights if you are 19, you decide my job is to let you know is that ndikuvalile awuzubuya after 4 years ufumane Mr. Right uthi mina zange nditsho nifuna abantwana. I have to let you know that if uvaliwe, we can't undo it because of the way siyenza ngayo. Even though ndikuvalile, there's a 1 in 200 risk that you might still fall pregnant even though ndikuvale kakhle. It's not my fault. You still have to come back for pap smear zakho. It will not protect you against HIV, and uzawuqhubeka ixesha lakho lizawuqhubeka as it is. It comes back to lando benthethe ngayo autonomy, that if you feel when as a 19-year-old already uqinisekile, even if you have 4 children, it doesn't excuse you from things of life, because abantwana bakho bobafo unfortunately can be in a car accident and all die. So you have to, before you vale, you have to think of the worst case scenario. If you accept the worst case scenario and you say it's okay, then ngokomthetho I have to allow you ba uvalwe. You just have to sign down uthi Dr. Simamon Khazelo ba andizokwazi ukubuyisela hleze ndimite, then sisign sivumelene. If sivumelene, then you can have the procedure. So it's your right. You have to be informed though, ufuna kuyazi. And now ke ngoku asizokwazi utshintshelana then ube ufikile uyanjikela ngokuba andiyazi mina loo nto leyo ndavalwa ngenkani. All right, so that's the main question, because when they've done a research, they've actually seen women less than 30 xa bevaliwe, they have the most regret. And into ebangela loo nto is that most of them babevalwa xa in labor and you're in so much pain, like ingqondo yakho sebenza uthi andisafuni, then uvalwe, then you realize what you've done. Bible, I've actually disvalile, I can't have children, and that's where the regret comes from. So we usually had said at 30, definitely, but if you want it and you're less than 30, it's your right to have it.
Is there any more questions? I think it's only fair that we let you guys know where Dr. Zulu, not Dr. Smamba, Fumane Kapi, because I'm sure after this, the coordinators are specifically with Usisi who had that mammogram, and then the information there, I was like, hey, it's concerning, so maybe you will have to have that additional conversation with Dr. Zulu maybe on that matter. And I learned something interesting because Ngokben by introduce, I didn't give their background, and I believe we're in the presence of greatness actually when I'm going through from what I saw from Ubabalwa is that as much as they are both medical practitioner, I found out that Dr. Zulu is actually the first black female surgeon in the country. And yeah, you can get her practice, I believe, is opposite a private hospital. Yes, number 72 Ebden Street. Yeah. And then Dr. Smama as well, I'm actually impressed. Like, she's a GI Jane, guys. Like, she's got a military background. I'm like, wow, this is so interesting. So yeah, she also studied her medicine in Madunsa, and looking at her credentials, she's got over 10 years of medical experience on the field. So if you want to continue having those conversations, we are from Maneka, she's got a practice in Prince Alfred Street. And I was so happy as well to hear from Babalo that it's actually a women's health center. So it just gives a broadened scope of how intense now we are going to understanding ourselves as women and understanding our bodies. So before Ndinike Ubabalwa to give her little closing remark, I just want to remind people, if you want to live stream, go back. If you want to go back and check this conversation, or you want to share this moment with other people, you can live stream it on YouTube at MT live streaming, and all of those who are posting on social media, whether it's Twitter, Facebook, Instagram, can you please use the media hashtag, that is hashtag #SheWellness. So yeah, I'll hand over to Ubawa.
Molweni. I'm just here to thank everyone that was part of this event. And also, just to add on what Husnai was saying, I'm sure you saw there were pictures being taken. So pictures are going to be available on the Women's Wellness Center on Facebook, as well as Avenue Media House. And there are goodie bags, guys, so just make sure you don't leave before getting one. I want to thank the Wellness Center, the Women's Wellness Center, first of all. Dr. Simama and her whole team, her brother, Usbahle. We all know Usbahle. So I want to thank them, for igniting this idea, because I could have had this idea, but without them, it wouldn't have come to life. I want to thank this place. It's new, guys. It's a coffee shop, My Coffee coffee shop. It's black owned. First of all, it's black owned, and they really have nice coffee. The bar is open for anyone who wants to order the coffee, and there's a coffee I want to thank them. Usisi ke ndandimazela kwaWimpilo waseLukhanje. So no, sorry, Nonesimo. She was very nice. So the first time I came here, she was very welcoming, and we had a conversation about this place. And they're open to say, should you have events, bring them here. So they're very nice people. Bye bye mamela man yonke into. And then the deco, niyabona masiba kuhle apha. Khona la sisi wasemalahleni. Cela phakame. Phakama bakubone. Asanda is a businesswoman. She's a young, sizawuphuma kodwa kule nto ka-young. She's a young black businesswoman. She does decor, she does catering. Nancy Benaye company yakhe, she does amazing work. And nange last minute, yambila umntu. Yaqobisa ke, a nice person, but yakanqobisa. And Asanda Lisa, who came through with those balloons. So if anyone wants to do kiddies parties and stuff, she's the person. Pakama look now. Kiddies parties, guyasbeteleza balloon, naye last moment things. Because once again, they mentioned she like Dockland, but everything was last moment. And I want to thank MT Sounds. Well, we had initially we had booked for just the sound and all of that, and it was like, no, actually, like I want a live stream. Yes, sometimes like I'm anointed, but she is anointed. So I was like, no, I can live stream, and he was very much useful. Kwalapa, figure on time, very professional, also black and young, unfortunately male, but and then I want to thank the host. This event, guys, it was just anointed, but everything just came together. Usnaye, Ujonase, we know each other because like we were in the same circles and stuff. Like Kunsan is very small. However, we only like clicked like on social media. She's a feminist first of all. She's a young professional. Downplayer, guys. Downplayer enzima. She's at Makana municipality, but ngowalapha Komani. Siyamazi sonke apha. She's a powerhouse. I always say, like, that's how I've just been describing her throughout. She's a powerhouse. She is strong. You know, she's very mature, but she's very mature. And there's a lot that I've learned from her on her social media. Hence, we connected, and hence the end I'm glad. And then I want to thank the two, guest speaker. Yes, they had a beautiful presentation, informative, and it was very impressive with how, in as much as maybe layman's terms, but you could still, you know, understand, like, nobody be check on yabo, but they really tried with the layman's terms for everyone to understand. Thank you so much, Dr. Zulu. Thank you so much, Dr. Simama, for supporting this idea, you know. And then there's some ticket sponsors, like, like, I'm not even in Queenstown, but I want people to come. So I want to thank the ticket sponsors and the Wellness Center for selling the tickets as well, that side, because we had asked bana ibe payana and then ibe lapha kuthi siyithengise. I want to thank them as well. The media houses, Ndateliza, Pagamanga lofnibon. The rep, no, Andisa. These are my people, guys. You know, they've been supporting my ideas. Even at the time, like I was still at the Express. I mean, the rep and Express, like competition. But when he does an event, can use it all. You know, I want to thank them. You know, they never disappoint. Zintlana. From primary to high school to varsity to Express, you know, we've been, you know. So thank you so much. As well as, okay, I get kumdu at True FM, but earlier, like in the week, I was called by True FM because they saw the posters and someone had influenced them to call me. So I had an interview in the midday show about this event. So I want to thank True FM in their absence. Kana nye team yami yasevukani nayo. Na bonso diba yo so ba qubula kuba hayi man can interview le force yam. You know, they always game, they never disappoint. I really want to thank them. I want to thank abanye abantu endimanya nabo kula manyano yasewisile yamantombi. Nabo ke I'm always, you know, they're always so supportive, like, of my ideas. Nditsho uba ndithumele phaa egrupini uba hayi man khanizini ivice yam ikhona. U-ex-vice wethu ebesivulele ngomthandazo naye uSimbuyi, uNox unobhala wami, nomqonqozi wethu uThabisa, shine. I really wanna thank the ladies and Konzanabo, you know, they've always also like been supportive. They always attend my events. And then I wanna thank my mom. She's here. Pagam, Ndagam. I wanna thank my mom. Ben I no longer Galoxana love. Yeah, Victoria, same name. So that's my mom. I really want to thank her. You know, one thing about my mom is that the candy figure get my business. She'll support that. Fig fund journalism. Okay, the fund came back and he could go and fund any mama PA communication. Okay, pin and boy, I'm and funa express. Okay. Look or everything, you know, that I come home. Like I'm a colorful child, you know, like my personality. I'm very divuga thing and gonna and inside I mean, I was like 22, but she supports everything that I do, you know, like Zange want to put her down, you know, and a lot of confidence in doing things comes just from her, like, trusting me. So as those injuries are possible because the Malaranduba Ekayak I will zang and I fumana londo, and I'm really grateful for her. And then I want to thank my friends. Conifos, Ayanda, and Zinklan. You know, I want to thank my friends. I want to thank my social media friends. I want to thank friends of Dr. Simama, you know, because some people are just here because of her. I want to thank friends of Dr. Zulu, you know, for like always supporting them and coming through. I want to thank their friends. I want to thank their family, my friends and my family, everyone who's just been sharing, liking, and supporting this whole idea. Social media, like by now, COVID, but before IR, so we have online friends, you know, official online friends, and we have offline friends. So I want to thank all of them, you know, on behalf of Dr. Simama and on behalf of Dr. Zulu as well. And then finally, my team, Wapelele, guys. Wapelele joined the company in July, but she's been amazing, you know. She's still young. Great. She's still young, but like she supports my ideas and I support her idea. Like we make magic at the office because it's both vibrant people, you know, who are easily liked. People are anointed, you know. Benimbona Nalapa. She's new in the media space, but like the way she's just carrying herself out, you know, like Nabaya Bandu who have been recognizing her work. So I want to thank her as well. I want to thank everyone who came. Thank you so much, guys.
All right.
Thank you so much. I think, Nat, we should say thank you to you for creating this platform for us because we try have these conversations on social networks, as she put it, but I think generally the world is going through a terrible and emotional time, and when we have discussions, you are so unsure of the reception that you're going to get. So there's always that one or two people that want to fight you on something that you want to address. And I think we need to appreciate Ubabala for actually creating a space where we can have these conversations. And I hope that you don't stop. It doesn't stop with this. You continue talking about these issues and other issues that weren't addressed today. And I'm definitely going to come through on the next one, even if I'm not going to be doing this. But I'll definitely come to support because in the community in general, I say Queenstown, it's something very impressive that I hope Grahamstown people could see this. Like so many women in one room with a common goal. It's a beautiful thing to witness. So without dragging things, there is lunch that will be served. I hope you enjoyed yourself. I hope you enjoyed the lunch. You can stick around and mingle, take pictures. Don't forget hashtag #SheWellness. Yeah, so to everyone, hope you enjoy the last hours that are left of your weekend. And those who are driving, I hope you drive and get home well soon. Thank you.
Sorry, before Niambe, I'll be a terrible guest if I don't answer all the questions. Mama Triplets had asked about e-tampons and something that we really see that's called toxic shock syndrome associated with the tampons. This is very rare. It happens less than in 1 in 1,000 women. This is even a number that's higher. This happens, so especially kubantu abangaziqhelanga tampons, then we libale ingunde. Then that's where the problem comes in, okay? We've literally had people who've forgotten their tampons and they come with ivumba and then you find a tampon in the vagina. So it's those things. It's not your normal use. Apo ipumayo within 24 hours you kupile. It doesn't happen, but it's those women who actually forget their tampons. And it's basically a very dangerous thing because you get a severe infection that you actually could die from. Okay, so it's very rare. It's not everyone. So continue using your tampon safely, but don't forget it in the vagina. All right. Then usisebetete infertility journey. I think I basically touched on infertility and its causes. So if you look at 10 couples, I've said 3 to 4 of them, it will be amatumbo, H fallopian tubes will be a problem. 2 to 3 will be an ovulation problem. So ikanda liphume kumama. And then 30% will be in the ukatata, either incinci, okay, or akanambewu at all, into by azoospermia. So ndiyaphinda ndiya-emphasize, when you come for infertility, it's actually, for treatment, it's initially investigation, because we define infertility emva konyaka nizama without using condoms, family planning, and been having regular intercourse. Within a year, you should be able to achieve a pregnancy. If I yenzeki loo nto leyo, then you need to come for investigations, the 2 of you, please, okay? So I think I've touched on the infertility journey and infertility causes. And then just to close as well, I also like to thank everyone for gracing us with the presence. Zenu, my patients that are already mine, thank you guys for coming through. Family as well for supporting this idea. My friends and the media houses as well, and I know Qubule and said please do this. So thank you for everyone, including my coffee. Then I know we're all tired, including myself, so we actually have got 3 massage vouchers to give away. So I'm very competitive. So akondo ya mahala in this world. I've had to work for everything I have. So ariye. So I'll ask 2 questions, and then Dr. Zulu will ask the question, and whoever gets it right, unfortunately, Sisi will be the one to the questions, all right? So, true or false, injectables can make you fat? And let's just be...
Well, because the injectables, they make you eat a lot. You can get fat. It's
Yay! All right. So the one goes for you. Okay. And then last question. Give me the causes of infertility. All 3. Which I just said it. So I just said it. 3 causes.
Iyakwazi ukwenziwa yimbewu katata encinci okanye engekhoyo. Iyakwazi ukwenziwa zilaa nto yokuvaleka ii-tubes due to laa nto yenziwa yi-chlamydia ziblokheka ii-tubes zakho.
Going once, going twice. Oh, we're changing the question. Prof, okay. She answered two, but the doc did not say it's correct or not. Am I right?
She's got 67%, so looking at our educational system, that's above average.
A pass.
So it's a pass. We'll give it to her, because we're nice people. Likanda. I'm a nicey.
Okay.
Okay. All right, so we'll give it to you.
When should a woman with an average risk for breast cancer go for her first mammogram screening?
40, age 40.
I'm sorry, ladies. I know everyone is excited because they've got little gifts, but Sino who just stepped out while we were still in conversation, and she feels that there's a question that, she feels that she has this question that she feels that she needs to ask. Yes, she's friends with Dr. Smama. She could have asked it ekaleni, but we felt that the question that she needs to ask might actually help somebody out there. So can we just listen to the conversation and get the response on it?
Okay, afternoon. So my question is pertaining to emergency contraception, which in other words, the morning after pill. What is the best and what are the shortcomings of it? I'm asking this. I know personally 6 people who are mothers now having followed the proper, so what is the what type of hormones are in it and what's the best in terms of in your experience, what is the best mode of emergency contraception?
All right, very good question. It's better xa uqhuba imoto yakho and you see that there's kuzawuba kwi-truck to brake from a distance, right? So meaning you use your contraception kakade, uzendleleni already. It's very difficult xa ubona i-truck isema nawe you put i-brakes ukwazi ungayitshayisi. It's tricky, it's dangerous, okay? So that's emergency contraception. The issues esinazo is that women, for you, because we sebenza for emergency, there's strict rules to it, okay? If usisithetha ngeepilisi, the ones bazakunikeza, because i-options zakho uzathi uzasebenzisa ipilisi, okay? Ikhona ipilisi oyi-1 oyifumanayo and then uyithathe after 12 hours emva kuba uyithathile. That's basically the best one. Or if abanayo, then bakunikeza eziya zininzi, about 25, uphinde usele enye 25. That you must use if you have intercourse, it might have caused you to fall pregnant within 72 hours. So it can't be more than 72 hours. And problem is that remembers after a week by yoke and then maybe I should just go. So that's the first problem, is that you have to use ipilisi within 72 hours, otherwise ayisebenzi. We can actually, so ezinye method, so is ipilisi, okay? Then the second method you can use is a loop. You can actually have a loop put in within 5 days, all right? Because in those the loop, if there's anything that's starting to happen, is I disrupted that process. So you can actually have your loop put in within 5 days if you think. So if it would really like 3 days, we would usually then say fake loop rather. Okay? So fake loop, if you then save, it's up to you. You can keep the loop for 5 years, or otherwise then if you think you still want to have another pregnancy, then we'll take it out and then continue. Okay? The other things that you can use, mifepristone or mifegyne, that unfortunately is a prescription that we have to prescribe for you, and that you can also use up to 5 days. And then there's something called Ella1, that is starting to be available in South Africa, and that you can also use for up to 5 days. So it has to be within 3 days for Ipilisi. So the option is the Konipilisi 1, that you take 12 hours apart. Otherwise, they'll give you a Zimbini as well, 12 hours apart, or otherwise 25, okay? 12 hours apart. It has to be within 3 days. Otherwise, the loop, Ella1, Nemifika, up to 5 days.
As you're explaining this, I'm thinking of the people that when I go see their boyfriends and they have periods, and say, "Doc, can they please stop now? Is that good? The pills that we give to stop their menstruation, or how often can you use, or must you use once, or what?"
Okay, it's not, so the answer is not great because you're disturbing the natural cycle. So if you do that, then you're gonna make your cycle be irregular and sporadic, and they might have breakthrough bleeding. So the safest way to do it is if we are asked, okay, you're gonna meet usebenzi pills, for instance. You know by period yako is about 28, but you're on the pill and you don't want to have a period. Do lando mentete ngayo, that's called tricycling. Most pills will have the same color tablets as Bay21. Then you'll have the red S7 as Fanayo, that's placebo. So what you do if you want to tricycle, uzawuthatha la 21 uzigqibe, ungayithathi red S7, la 7 red, uqhubekeke nenye ipakethi, uthathe la 21 uyigqibe, uqhubekeke nepakethi yesithathu, usebenzise la 21 uyigqibe. So that means you saved yourself 2 periods. So you can safely do that without disrupting your cycle. And then after ipakethi yesithathu, you have to take the red so that to be in a period. So it helps especially for Omakot if you're gonna get married, you're on the pill, but you don't want to have your period, so you can do that. It also helps if you've got bad, like I said, bad period pains, so you can skip your periods intentionally. Then we from another 3rd month, so it also helps with that. Or you have heavy period, then you can also do the same thing. If you do that, then it's gonna get you basically disrupt the whole cycle, and then they get breakthrough bleeding, and then the cycle is just sporadic. Oh, and then other commonly thought of but not asked questions is when can you safely start contraception? After your menstrual period or during your menses is basically the safest time to start a contraception, because we know you're not pregnant when you're having your period. So you can start your tablet injection, you can put in your loop at that same time.
Osomandla uzuyigcina impilo yami.
bebe sithange silunge bebe sithi ndiyadlalisa kodwa mna ndandiyazi uzophelela pha kum jonga ngoku neminyaka ihambile sithandana xa bendingaphinde njonge